Okay, so let's look at our hematomas and talk a little bit about each one. So with you have an epidural hematoma, you can see in your picture that is something that occurs when the blood or there's a bleeding inside the between the skull and the dura. Generally speaking, there's a tear in the artery that's causing or contributing to this. And so if you think about arteries, usually arteries are larger than veins. They're a lot more, I think, about blood flow and pressure. So when you blow an artery, this is going to be a big deal. You're going to bleed a lot faster than you would if you blew a vein. So when we talk about epidural hematomas, the significance is that these are usually sudden onset. The bleeding occurs between the skull itself and the dura. The tear is usually arterial, so it's fast, it's a bleed. So you're going to see signs and symptoms generally quicker than you would with a venous tear. We usually see this kind of hematoma more common in younger generation, younger people, just because the adhering of the dura to the skull is thinner. So what happens is they have this injury that occurs, and then they become unconscious, and then they wake up. Okay, they become lucid. They have this period of lucidity where they wake up and they're like, what's going on? What happened? And then they rapidly decline again and become unconscious. What we see here is that there's usually an ipsilateral pupil dilation and contralateral hemiparesis. Okay, and we talked about hemiparesis meaning half weakness, right? So what we see is ipsilateral pupil dilation. So that means the same side. So if I had a head injury and I lose consciousness and I'm out of it, and you're opening my eyes to do a pen light, right? You're checking my pupil reflex, and my left eye is dilated and fixed, and it doesn't constrict to light. And you notice that I have a lot of I have weakness and hemiparesis to the right side. That is consistent with a epidural hematoma on the left side. So whichever side I have the ipsilateral dilation on, that's the side that's affected. And because the brain controls the opposite side motor function, then that's why you see contralateral hemiparesis. When we look at subdural hematomas on their slide, you can see again that one occurs between the dura and the dura and the arachnoid space. And generally, this is a venous tear, so it's a little bit slower to develop. Sometimes somebody might have something happen and not know and not have symptoms for like 2 weeks. So they'll have this bleed in their brain slowly trickling, right? And it may not notice anything except for a headache for a little while. That's why it makes the subdural hematoma higher mortality rate with that one, because that whole time that you have that slow bleed and not knowing what's going on, they have swelling in the brain, they have ischemic tissues, compression, death of tissues, things are happening that you can't get back. Whereas with an epidural hematoma, it's like it happens so fast. Usually you catch it, you know something's wrong, and with an epidural hematoma, if they can get you in and open up your skull and evacuate that hematoma and let the bleed out, that person might have full regaining function. But with a subdural hematoma, there's usually going to be some lingering effects, things because they've been going on for so long before we actually caught it and figured out what was going on. So which one has a better prognosis? Actually, the epidural does. We see subdural hematomas more common in the older population. Again, that's usually your venous tear, and we see that again in our older population versus the younger with a epidural hematoma. So how is subdural hematomas different in their presentation of symptoms? Okay, you got a brain bleed, right? So once somebody loses consciousness with a subdural hematoma, they're not going to regain lucidity, okay? So it's slow, 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 progressive thing, and then whoop, they're out, okay? They might have had a headache for a couple of days, nothing, just vague symptoms, maybe some pressure in their eyes, vague things, and then they lose consciousness. And we go, oh my God, what happened? And you're like, oh, well, they were in a fight, or they had, they fell a week ago. He hit his head, but we didn't think anything of it. And maybe, or maybe not, maybe they went to the doctor, maybe they didn't, and had some kind of test done, didn't show anything because it was such a slow thing. Whereas got hit with a baseball bat, maybe, and has an epidural hematoma where this bleed is just coming out real quick, and all of a sudden they lose consciousness, and then they have this moment of lucidity where they wake up and they're like, oh my God, what happened? And then again, within a few minutes or so, they lose it again. You're not going to see that waking up in a moment of lucidity occurring with a subdural hematoma.